Perfect. All right, well, welcome everyone. Thank you for joining us. I'm sure some other folks might be trickling in throughout this presentation, but thank you for joining us this morning on this beautiful Sunday. My name is Jay Lawanag, and today it's my privilege to present Dr. Joan Turkus on this, like as I mentioned earlier, this very important topic of resilience. But before we start, I thought I would start us with a little bit of a prayer that's based on resilience. It's based on Isaiah 40:29-31, which says, "He gives power to the faint and strengthens the powerless. Even youths will faint and be weary, and the young will fail exhausted. But those who wait for the Lord shall renew their strength. They shall mount up with wings like eagles. They shall run and not be weary. They shall walk and not faint." Let us pray. Lord, you are our keeper and preserver. We have a promise spoken by the words of the prophet Isaiah that you, loving God, give power to the faint and strengthen the powerless. We know that our ability to be resilient comes from you. We thank you that you are our help in all circumstances. Yes, even in these times of unprecedented circumstance, you are an ever-present help. As the world changes around us, help us to embrace the change. As we are stretched to our limits and beyond, be our elasticity to snap back better than before. Grant that we may find calm through your divine peace. Equip leaders, first responders, researchers, and all humanity with the resilience to combat the virus. Give us discernment to recognize trauma in our bodies and the skills to draw on resilience. May our guide be empathy as we journey together as one humanity through these uncertain times towards recovery and your new creation. It is in Jesus, the Christ's name, we pray. Amen.
Amen.
So now it's my pleasure to introduce Dr. Joan Turkus. For those of you who don't know her, Dr. Joan Turkus has been a member of St. Mary's for 20 years. She has a keen interest in spiritual formation and spiritual journeys. She has co-chaired our spiritual formation committee for 4 years. She has shared her creative energy with many of us in leading small groups and doing adult forum presentations for us. This is the 4th in the past 3 years. In her professional life, she's the medical director, Trauma Psi Complex Trauma Disorders Program with both inpatient and outpatient components at Dominion HCA Hospital in Falls Church, Virginia. Dr. Turkus has years of experience in the trauma field as both a clinician and maintains a national profile with teaching and consultation. She is a distinguished life fellow of the American Psychiatric Association and a fellow of the International Society for the Study of Trauma and Dissociation, of which she is a past president. She has been awarded a Lifetime Achievement Award, the Cornelia Wilbur Award for Clinical Contributions, and a Distinguished Achievement Award by the International Society for the Study of Trauma and Dissociation. And by the way, she has 2 grown children, 8 grandchildren, and 1 great-granddaughter. It's my pleasure to introduce Dr. Joan Turkus.
Thank you, Jay. I was thinking as you did that, I hardly recognized myself because it's been a life journey. But I'm glad to be with you this morning. And obviously the subject of resilience is dear to my heart. And it's so important in the field of working with trauma survivors and the bigger social issues that we are all living with. So I wanted to share a concept with you. Whoops, hold on. Which I often think about, which is essentially like dropping something in the center of a pool and creating the circles, and how we need to reach in and take care of ourselves and those around us, and then out. But from this center in which we, foster and nurture our relationship with God. So I want you to remember that, because I've seen too often that people get focused on the outer circles away from themselves and end up being exhausted and angry. So I think it's important to think about it as all these circles have to be filled. So I'm going to focus today primarily on the pandemic. And, obviously we are having a major global health crisis. And we're dealing with an invisible enemy, and which creates so much fear and uncertainty. And we've also dealt with delays in detection and available testing, and even questioning the accuracy of some of it. And also the shortages. We're still short of protective, gear, particularly for nursing homes, by the way. And we're also facing a shortage of ICU beds if this surge continues. And also thinking about supplies for daily living. And there's none of us who doesn't remember the toilet paper shortage, right? And I think periodically we deal with, paper towels or whatever it may be. And I don't know anybody who's been able to find disinfectant wipes. If you have, let me know. But I remember something my mother said a long time ago: soap and water works, and it really does. There's also the whole issue of quarantine and the isolation and the economic loss that's so, prevalent. And then the issues of misinformation or lack of information, and trying to stay grounded with what's real. And I think the constant media coverage, this is true in any disaster, it really, you have to focus on timely and accurate information, and just avoiding the enhancing distress and fearful kinds of information to an extent that is really creating more traumatic stress for us. There was an interesting study after 9/11 of looking at people who watched, the towers and that whole experience, and they were doing the, television, and there was so much sensory input. People who watched more than 6 hours had traumatic stress. So the same thing is true now, and I would just encourage all of us to be careful. And the other thing that Jay mentioned is we're really living in the midst of multiple crises. It's not only the pandemic, but it's the racial injustice and the climate crisis and all the political unrest. So that there's so much that we're bombarded with every single day. And I want us to think about a concept that really works. We learned this, I don't know if any of you have ever done the Red Cross disaster training, but these are the principles that really apply now as to, any other kind of disaster. But it's to prevent the PTSD and depression and anxiety that overwhelms people. So always think of it as safety, support, and resources. And I have the little picture here of the St. Bernard dog, because I think the dog represents all of those. When someone's lost in the Alps and frightened and alone, and the St. Bernard dog finds the person, you have a sense of safety, you have a sense of support, of leaning on the dog, and the dog's going to lead you to safety. And I always think the little whiskey keg is, a symbol for the resources, because when you're cold and freezing, apparently it really helps. So I really want to try to normalize and just talk about what we're all experiencing. So we all have multiple fears, right? We're thinking about all the fear and the worry about our own health, particularly the vulnerability with chronic medical conditions, and not only ourselves, but all those people in our lives that we care for and love. And how do we balance the whole problem really of work and family, because there are now so many competing needs, particularly, for example, if you're working from home, and how do you do that? And I know that parents who are faced with doing Zoom school, you know, how can you be both a parent and a teacher and keep your own life together? How do you reassure children and their fears? And we all worry. You know, the American Academy of Pediatrics has put out some very clear statements about how worried we are about normal development for children. And I guess I would include adolescents and college-age students in that as well. And certainly the economic impact and all the traumatic stress symptoms that we do experience. And the other issue is, how does faith fit into all of this? Have I lost my faith in God? I think that also is a factor in all of this. There are so many people who are wondering, why is this happening? But I remember something that, I'm just trying to think, I think it was Winston Churchill who said, you know, never let a crisis go to waste. I think God does that as well, never lets it go to waste. So I think there will be a lot of positive things that happen as a result of this experience. So I put this together for us because I was trying to organize my own thoughts about the responses. So I wanted to start with thinking about what I hear every day about sleep disturbances, fatigue, irritability, lack of motivation, loss of a sense of time. Somebody said to me the other day, the only way she knows what day it is when she hears the trash truck. So she knows that it must be Tuesday or Friday. And, you know, all of the somatic symptoms, I mean, we experience this in our bodies. I think I've talked before about resilience. We have to think of ourselves as one organism. You know, the mind is not separate from the whole being. And I know many people have a crisis of faith. So those are what I think of as the usual reactions. And the other risky behaviors that I hear about so often are, you know, increased use of alcohol and substances and excessive food. I don't know how many of you have heard about COVID-15. It's like, you know, freshman 15, but that's another issue that seems to be so common. And the, you know, disruptions that we have in our lives, that's really destabilizing for us. And then we have people who they're in denial of the need for precautions. I think they have reached, it's not only political, I think there's a pandemic exhaustion and just wanting to do normal as well. And then there are other people who are really obsessed with the news and the rumors. So that's a caution. And obviously, if you find yourself in a serious depression or severe anxiety and having panic attacks, and you know, you're really there for thinking about post-traumatic stress disorder. And I can assure you that that is exactly what all of our healthcare workers have. And we're going to have a long mental health footprint for all of this as well. And then, of course, you know, there is the issue of losing people in your lives. And I would encourage you to reach out if that should happen. But I think there are many more ordinary things that we can think about doing. So obviously there's a focus on structure, you know, and balance and being mindful, all the calming strategies, and thinking also about really reinforcing prayer in our lives, and there are ways to be part of our worshiping community. And I don't know how many small groups we have. I didn't count them up, but there are many. And the whole issue of really thinking about the basics of sleep, nutrition and exercise. And the other issue about social support. That's really incredibly vital now. So I'm just trying to organize that for us, and we'll talk about some of these things. So this is my image of myself, that there are most days, I think, that I feel as if I'm losing a strand, it's getting loose, and I'm kind of okay in the center, but these losing some pieces here. And there are other days I really feel like this, that I'm in the that lighthouse, and all this is going around me, and I don't quite know what to do with it. Somebody said to me the other day that, what did she say? Something like her glass was half full and the water's still leaking. So, I mean, people have come up with all sorts of expressions to try to explain how they're feeling in the midst of all of this. So I wanted to share this with you. I tried to simplify it for us. So we have an autonomic nervous system. And when we are in that state of being hyper aroused and agitated and overwhelmed and feeling so anxious and we want to run away, our sympathetic nervous system is really on overdrive. So that's the part of us that, puts out all that adrenaline. And if we are on the opposite side of being hypo-aroused, we can be numb and not caring and shut down and just give up. And then we're sort of too far along in the parasympathetic system. And what we really want to achieve is a balance in our autonomic system. So the balance of both sides of that, where we can be relatively calm, we can think and feel at the same time, we can be curious, present, learning, all of those good things about that state. So all of us have to recognize that when we're in, too much or too low on that scale, that we really have to find ways to get back in the right window in order to cope. So we're going to talk a little bit about ways to do that. So let me assure you that breath is key, that when you are really breathing and taking deep breaths, you're engaging your parasympathetic nervous system. And if you were in my office, or actually if I were in my office, I have some little thermometers that you can hold in your hand, and you can actually see, if you continue some breathing, that the temperature goes up, because what happens is the capillaries open up all the way and your fingers get warmer. It's amazing, really happens. So I often thought I should have this little sign in my waiting room, right? Either that or keep calm and I'm taking a 15-minute break. So let me try to teach you a couple of simple exercises that you can take with you. So I often teach people how the Stomp exercise. So it really means finding a way to stop. That either you can envision that little stop sign, you can say it very loudly. If you're a place you can say it out loud, you can, but if not, otherwise, internally. And you want to take a deep breath. And then you want to find some way of backing off into a place of perspective. It's very interesting when I do this with adults, they almost always think of a hill or something where they're looking down on whatever's going on. So they're finding that place in their minds that they actually can look at all of this and continuing to breathe. And then they can look at choices. And I think I've seen a very simplified version of this intervention for children. You can teach children to breathe and to, in fact, it's used in kindergartens. It's been used for a while in looking at behaviors and teaching young children to stop, to breathe. And then, of course, you would have to provide the choices. And it's interesting that children, if they're given choices, feel more a sense of control. I guess that makes sense. True for all of us, right? So I don't know how many of you know about the butterfly hug, but if not, I'd like to teach it to you. Actually, it was first used, to my knowledge, in Africa for children who were victims of horrible revolutions. I remember children in Sierra Leone after the guerrilla warfare there being taught. The butterfly hug. There were like hundreds of orphans after that horrible time. And it really makes a lot of sense. If you know a little bit about EMDR, which has to do with bilateral movement, this is what it is. I'm not sure that was realized at the time, but what it is that you're crossing your hands. I'm going to do it for you, right? And you're alternately tapping. So what you are doing is, I think it's also some comfort in hugging yourself, but also that when you do the alternate movement, you are stirring up both sides of your brain. You remember that the right side of your brain, for example, controls the left side of your body. So what you're doing by alternating is you're activating more of your brain, and it gives you a sense of being able to get to that balanced place of being able to think through choices and, not being so overwhelmed. So it may seem simple and a little silly, but it's amazing that if you're willing to do that when you're overwhelmed in that, difficult place, it does really help. And I think probably you can watch, everything is on YouTube these days. Although I've seen some variations of it, but that are not quite correct, but you have to do the alternate movements for it really to be effective. And this is a slide that I took from my talk about resilience 3 years ago. And if some of you don't have those slides, I'd be glad to send them to you. I think I still have them on my computer. But thinking about ABCs when you're in some sort of place where you can't quite get grounded and think of what you're going to be doing, what would help. So you want to have some awareness of what's going on with you, right? And at the same time, thinking about what are the resources that are available to me. So you have to do the calming and the resources. And I do think it helps to periodically, and maybe I used to suggest monthly, but maybe I'm going to suggest weekly, that you think about doing an inventory of what's going on in your life, what you need, what works, what doesn't work, and to be creative about it. And that whole sense of really maintaining a balance that gets so disrupted these days, and also maintaining that connection. And I think one of the things that we do, particularly when we reach out to each other and reach out farther than our parish, that really helps to give us a sense of purpose and helping to create positive change in the world. So it's all important. So I want to talk a little bit in my role as a physician. I think it's important to do so many of these things because it's important to maximize your health and that of your family, because I think that's not only protective, it's just good for us in the long run. And, you know, the one thing that we don't think about as much is that we can budget risk. I mean, there's certain things that are so important to keep our lives together, like getting supplies that we need. If you can't have them all delivered or somebody else can't do that for you. I think it's important to keep up with medical and dental visits. I think all of the, you know, medical clinicians that I know are being exquisitely careful. They've established all kinds of guidelines of you wait in your car or until you get a text or you call in. And so they're taking one person at a time, spreading them out. And the same thing is true for dentists, and the dentists are all taking exquisite precautions. I don't know if many of you have been to the dentist, but you even have to do a peroxide mouthwash before the dentist will do anything. So, you know, you can really budget risks, and you can avoid doing things that put you and your family and people you care about at greater risk. And one of the things that I think is so important is that physical isolation is not the same as social isolation. I actually wish that we had used different language, because I think it has confused the whole issue, that we can find ways to stay socially connected. And I wrote something recently and I said, technology is our friend. And I never thought I would say that. So here I am. So there are basics, right? You want to wear a mask when leaving the house or when needing services indoors. You want to stay with your own family that you live with. And if someone seems to be ill, that person needs to internally quarantine and then wear a mask, and as others in the family. You want to wash your hands with soap and water frequently. And I wish somebody would teach me another song, because I'm tired of row, row, row your boat twice. That's what I learned at the hospital, so I've kept with it, right? I think I taught my children the ABCs, but so you want to...
The doxology works really well too.
Okay, I can try that. And you can maintain physical distance.
Happy birthday song as well.
Okay, yeah, I think there are a number of others. I'll have to try. I have to be creative and try, right? And so you want to maintain physical distance, and actually medically, we're not quite sure that 6 feet is quite right, but maybe a larger space. And you want to obviously avoid gatherings and crowds. That's so clear. We now know that so much of the surge is due to large groups of people being together. And so there are some, we know that there are places that are more risky than others. And I hope I can't see all of you at the same time here, but I hope you've gotten your flu vaccine. I did. That's really important now. And you don't want to run the risk of having both things at the same time or spreading the flu. And I also want to say a couple of words about if you become ill, don't panic. A significant number of the cases can be managed with just quarantine at home, and they can be relatively mild and such. And the other thing I want to reassure you about is we are doing a far better job with people who are hospitalized. We have managed since spring to decrease the rate of serious complications dramatically. And so I think we have learned that. And that's really important. It's part of why we have to be exquisitely careful now and not overwhelm our colleagues and friends in the hospitals, because that's something we need as an absolute resource. But we do have far better therapeutics. And you certainly heard, some information about vaccines. And I was thinking the other day, I think it was Jenner in the early 1800s who developed the first smallpox vaccine. We had hundreds of years of experience here. We know what we're doing. We just needed time to do it right, to do it effectively and safely. So I think that there will be enough vaccines available, but probably, I'm being realistic, probably by late spring, summer, but we're also going to have to deal with distribution. I mean, we are fairly in good shape here because we live in a metropolitan area. I'm very concerned about more rural areas and availability because the vaccines have to be frozen. That's not an easy task, actually. But I think we'll get there. I mean,
Hi, Joan.
Yes.
There was a really good question from Ross Silvestri. Is there a way to address fatigue from only socializing through technology, especially those who are more extroverted? Have you seen some techniques for that?
I'm more extroverted. I was thinking about that. I think actually you have to do all the things that you can to be connected with people. And I know there is such a thing as Zoom fatigue because I experienced that. But I think it's important to think about the whole idea. Exercise helps incredibly. That's also something. And I'm doing exercise with my trainer virtually. So it's really kind of funny having my little, iPhone propped up on my bike and where she's reassuring and talking me through it. But the fact that I have some contact makes such a difference. Or finding someone that you can safely walk with. It isn't easy, and I think the other thing about being an extrovert is that it helps to reach out because that's our natural way of doing it. So the more we can do about reaching out to others, I think that can also help. So those are my quick thoughts. Probably more will come to me. So let me think about that in the back of my mind here somewhere. This is my t-shirt. And I want everybody to know, yes, I like it, the little face and the mask and love your neighbor, but you're also loving yourself. We know, and I don't think anybody has said that until more recently. I don't know why they didn't, but it also protects us. That if you are masked effectively, then you will, even if somebody is, contagious, who is close enough to have droplets in the air, you're going to take in much less of those droplets and not get as ill. So it really can make a significant difference everywhere. I think we may have changed, excuse me, the the age for children now. We're saying at least 5 and up. So we're modifying things. So let me think about one of my focus back to those circles. I think self-care can't be absolutely self-contained. It doesn't work that way. That a plan for self-care has to be integrated. We are interdependent. That, we're social animals, if you want to think of it biologically. And no one of us can get through this difficult time alone. I don't think it's possible. And I think that's so important for us to think about taking care of ourselves and reaching out, to those around us as well as the wider group. But I I think that's vital, and particularly like me, if you're an extrovert, I try to do a lot of that because I know that I don't think I'm made to be a loner or something, but I think also giving gives back to us, and it all, it works both ways. So think about that and doing more of that. And I also think it's important to create structure. If nothing else, download one of those, things that have a week and the hours and fill it in. I mean, it may seem foolish and it won't work perfectly and you have to be flexible, but still it's worthwhile doing if you're feeling kind of lost and not knowing how to turn. I can't tell you, I hear so often, what day is it? I've had patients say to me, I know it's Tuesday because you're calling me. So yeah, we have to do something with that. Was thinking about the patients on the hospital unit. We have a calendar and we cross it off so everybody stays oriented. So the other thing is, thinking about all those calming strategies. And, there's no question that emotions are running high. Somebody from, one of my colleagues from South Africa said that to me the other day. And we can be irritable. We have to have a certain level of tolerance to this. And practicing some of those strategies and limiting exposure, to the news. So the other thing, I know even though we may have a certain level of lack of motivation, it's a nice time to really think about creating more ambience at home and comfort. And I don't know if Tully's here, but thinking about simplicity and uncluttering and getting rid of things somehow. And putting out favorite things that we may have put away and that you connect with. And I have the little garden there because I haven't done it yet, but a lot of my friends are doing the little arrow gardens in the, if they don't have space outside or it's now getting too cold, but filled with lettuce and herbs and rather amazing, overflowing with it actually. You want to keep windows open as much as possible because you want to air out the house. And we do know that exchange of air is protective. And you want to create a peaceful place. I've long suggested that you have to find a place in your home, even if you have children and it's busy, to have a corner somewhere that's yours and peaceful. And there are so many resources. I didn't create a list for you, but maybe we could create one together and share it. But there are so many resources if you Google them about, you can do museum tours and gardens and various cities and music and dance and it's amazing, more than you can do. You can take classes, all the time if you'd like to do that. And intellectual kinds of skills are important, particularly now, learning new things. I think that's another protective thing that we can do. And also read widely. And not only fiction, but nonfiction and things, I was thinking including humor. One of the things that people are doing that maybe some of you haven't done, but a lot of people are looking at those skits from the past, whether it's Lucille Ball and the Chocolate Factory or that so many of you may have seen. If you haven't, do it. Or Carol Burnett or Jackie Gleason or things that are really, you just sit and laugh. And laughter is a whole mind-body experience, right? So, you can learn new skills. and there are lots of things available. I keep wanting to go back to knitting, and I can't remember how to cast on stitches, but I know there's a YouTube, so I'll find it. And all the family things that one can do. I mean, not board games and charades, and lots of people are playing the civilization games and all sorts of things. So you can also do lots of them if you have a small yard. You can do things outside. And I just got to get together a whole group of things. The one in the corner, the little creativity is intelligence, having fun. That's my journal. And here's somebody knitting, doing woodworking, you know, doing sponge painting, playing Frisbee. And the Lego sets that are available are amazing. I happen to be a Star Wars fan, so I picked these out. And learning to cook creatively, looking at recipes you've never done and trying them out. Things to do with children too. Paper boats and paper airplanes. And I think that, as I remember, the boats will float for a short time in the bathtub before they go under. But you can fly paper airplanes. You can play croquet if you have a space. Here's a child learning an instrument and another one singing. So there's just so many ideas if you stop and think about creativity. So you certainly need a sleep schedule and trying to stick to it. And you really need something like 7.5 to 8 hours per night. And please don't watch television before going to bed. You need to wind down the day and, really thinking about prayer and relaxation. And if you're going to read on your iPad, please get those blue blocking glasses because they really help. And you need to be in a room that's dark and quiet and cool. Excuse me. So you need to eat wisely. And I put the pyramid on another slide. And I will give Elizabeth the slides so you can have them. Think about more fish and a rainbow of vegetables. You want to eat vegetables of lots of different colors. You don't have to worry then about getting everything you need. And please try not to fall into mindlessly snacking on chips. Cut up vegetables or something instead. Think about exercise. And although the guideline is 30 minutes 5 times a week, I'd settle for 3 for most people. But you also want to do some strength training and stretching, and get an exercise buddy. That's also helpful, particularly like me if you're an extrovert and you don't like to do things alone. There's the food pyramid. It's lots of water, fruits and vegetables, protein, complex carbs, the healthy oils, which are primarily olive and canola, and, minimizing the sweets. So I'm going to talk a little about parenting. I think that there's something about stress and that agitation being contagious. So it's very clear that managing structure in Zoom school or even younger children at home, those are not easy tasks. So I think it's important. There's a little picture, she's on the phone, reaching out for help. I mean, if you're a parent and you really get stressed, at least have somebody to call, another parent, and talk for a few minutes. And children know that their lives have changed. I mean, obviously, they experience stress and fear. They hear adults talking. They even hear snippets of news. And they certainly experience the impact of school closures and losing time with friends. I mean, I really am, that's the piece that I think we're very concerned about. And so it's important to provide things. And there, I didn't put many resources here, but look, if you're a parent and you have children at home, look at the Mayo Clinic website. They have excellent articles about parents and children and suggestions. So you need to do the obvious things, which are reassurance and structure, and all the nurturing activities and distractions that you can conceptualize, and healthy food and snacks and exercise and sleep, and as much social contact virtually as possible if you're sheltering in place. So that's all those things are obvious and important. But I think it reminds me in terms of reaching around, we really need to reach around more to all the parents who are struggling with this in our parish. So the Spiritual Formation Committee decided to use this as our theme for the year about moving forward with courage and faith. So obviously we're all in this together, even if we can't hold hands right now. So breathe. Okay. I'm going to talk a little bit about our spiritual life together. And I don't know if Peggy Parker's on this, but thank you, Peggy, for the wonderful sculptures. So Mary holding the babe, and we have to think of this as reality, not just a symbol of our being held by God and each other in love and hope. And I think we have to start thinking almost more literally that this is real, and that love is a commitment. And we certainly want to be thinking about love in action. It's not just a feeling. It's a great deal more than that, particularly in this context. So how do we reach in? And I'm not going to talk as much about this. And some of the other adult forums that we'll do will talk more about it. But you want to do those things, you want to put spiritual disciplines in your life. I remember saying that I was a little bit horrified to realize that disciple and discipline came from the same root. But what all the things that help you to nurture and grow in our relationship with God, all the types of prayer that you may use in your own life. I certainly have discovered in my own spiritual journey and observing what happens with others that our prayer life is flexible, and certain things seem to be more appealing, if I can say that, or that we're led to at different times. So there's also, think about reaching out for lots of other things. There's all sorts of spiritual reading and books and emails. I finally downloaded the other day, just as an anchor, was a 3-minute retreat. It was just, those few minutes. And I can't tell you how many things have been recorded that are just gems to listen to. And all the sacred music that exists, and there's a lot of contemporary music which may appeal to you, and reflection and journaling. I mean, there are just so many things that are available to us. And I think that's something wonderful about human beings, that we have that ability to be creative. That's such an important part of us. It's not just that we're totally intellectual, but there's some other intuitive place, whether you want to think of it as that, where maybe that's where we connect with the Holy Spirit. May well be. So thinking about, I was primarily thinking about our parish here in reaching around, although certainly true for family and friends. But thinking about us, that we are the body of Christ, and there are enough spiritual mentors and guides in our parish, some of whom are sitting here. And, but I think also that whole sense of being willing to check on other people. being there to support and help. And also, I really want to encourage you to ask for help. I mean, I have enough chutzpah that I do that, but not everybody feels so comfortable asking for help. So we have to find ways to reach out to them. We can share and we can learn in small groups. We can contribute to our shared life, right? Where we give time and effort and knowledge, and financially we support the church and all that it does. And we certainly can pray for our clergy and support staff and each other, because we are a family. And I think that's important to remember. There is a sense of togetherness and closeness that we share. And I hear that from so many people in terms of our being a spiritual community. And then there's the whole reaching out. I mean, obviously we are engaged in that. And I think actually our next adult forum will be focused more on kind of a survey of the many outreach ministries that we're involved in. And we can study and grow in the responsibility to reach out to those in need. We can learn more, we can listen. That's important. That being able to sit down and listen to people is so critical, and listen to their experiences and learn from that. And particularly, of course, people who are different from us or that whom we don't understand. And from here, we reach out to people and groups and organizations close to us geographically and even farther away in the world. You know about some of those. And I think I always stop to think that we are commissioned, that we have a mission in the world, that we're Christ's hands and feet in the world, and we do this to build the kingdom. So, you know, I guess I've tried to take a comprehensive look at everything. And I want to end with a prayer, and then we can talk about the questions, or we can respond to them. So may God bless us and keep us and shine his face upon us. May he be gracious unto us. May he bless the space between us, around us, and beyond. May he give us healing and peace throughout all the lands. Amen. So thank you. This is a picture that was taken by one of my friends in New Hampshire, lives on a river, and took this yesterday. So I thought I would share it with you. So, Jay, do we have questions or?
I think you answered the questions that were in the chat. We have a couple minutes left. Does anyone have any questions for Joan? You can unmute yourself if you'd like, or you can put it on the chat.
Hey, Joan, thank you very much. That was really wonderful. I think both in terms of reminding me that I'm doing some of these things and that they are good, but then ideas for new ones. But I really like your idea that, you know, about being, you know, how this makes us also to be better neighbors to our immediate community of St. Mary's, but also the larger world out there.
Yeah, I think that's true. And it's important to be focused on all three spheres that I tried to outline, that they all are integrated.
Yeah, Joan, and I think what resonated with me, you know, in your talk and also our private talks in the past is just that issue of connectedness and that social connectedness. And I think that's extremely, you know, important and something that's easy to lose, especially during these times. And the, you know, question that Ross had asked about, you know, especially if you're extroverted, I'm kind of in the middle, and how difficult it can be when you're not, you know, connected from the normal way that we all used to be connected, and trying to find those creative ways to get together. Before your session, I was just doing some research because I really like this topic, and I saw someone posted like on trauma plus faith equals resilience. And that tie to that social connectedness that's so important. And I found myself through, whether it be work, personal life, professional life, and everything, that when I have that social connectedness, and I know, like someone mentioned also in the chat about these shepherds, and if I'm not afraid to ask for help, because we all need help, even if we might outwardly look like we're strong, asking for that help really brings out, at least for me, my faith, and really shows my vulnerability. And from the trauma, whatever it might be, having that sense of faith tied to it just connects to everything and gives me, I think personally, more resilience than if I did not turn to my faith. So I think what you've been presenting is definitely good food for thought, and gets me thinking more of how we at our church can even help and support each other, and hopefully be open to reaching out to each other, because I think that has definitely saved me throughout this whole cycle of the pandemic. And thank you for giving all these different thoughts and ideas.
Well, thank you all for listening, but you have to, I don't remember the Chinese saying, but you can learn it and think about it, but you have to do it. To really make it yours.
And Catherine had a very good question on, what are some tips you might have in terms of resources to help keep you positive when you are alone by yourself? We know we have a lot of parishioners who, are not with anyone, and that can be very isolating and lonely at times. Do you have any thoughts on what they could possibly do?
Well, I think it works both ways. I think those of us who are a little more extroverted need to reach out and gather up those people. And also, I think that when you find yourself alone, or, we're dealing with an incredible level of, I think I would probably say, existential loneliness in the middle of all of this. And so I think recognizing that, or if I'm alone, or I'm feeling bereft, or feeling down, or then that's the issue of reaching out, or being courageous enough to really join a small group, even if it's not something you're particularly interested in or haven't done. It's time to try new things. So I think that all of that can help.
Yeah, I think, Joan, what you said too, especially for those that are us that are extroverted, to really reach out to those people who might be, alone, because they might not have that strength to reach out themselves, and to give them that freedom and that comfort level to be able to, ask for help and ask for support, as many people I've already mentioned in the chat. So I think that's really important for all of us to be aware of.
I made a decision a while ago to reach out to 2 people per week. It's just my own thing. So I have done that just to check on them, ask them how they're doing. But it's also giving to me.
Mm-hmm.
Joan, I have a question I just wanted to get your perspective on. Even before the pandemic, I'm always someone who, as an extrovert, likes just randomly cold calling people and just checking on them and catching up on them. But there was, I think maybe in late spring, early summer, where there was a period where I just said, I am just done with calling people, because I'm just tired of it. And that eventually subsided into wanting to get back into reaching out to people, and I still do that. But is it a good idea in this time to even set limits on reaching out to people, so through one particular way, so you just don't get either, if not fatigued or burnout, or just tired of it?
I think that's true. First of all, I think in this time, our energy and our motivation kind of waxes and wanes. But I do think keeping it small and manageable is the thing to do, because otherwise you get, you could try to give too much, and then you're exhausted and get burnt out for sure. So I think that's the, It's certainly what all of my medical colleagues are struggling with, trying to avoid that. But burnout is real. And actually, there are other phrases that are used, like compassion fatigue. Have you heard that one?
I believe so, yeah.
I mean, there are a lot of other ways of expressing the same idea, but I think it's the balance.
Thank you, appreciate it.
Well, we definitely wanted to thank Joan for her time today and for everyone for joining us. Joan is an incredible resource. You know, I'm fortunate to have been able to chat with her one-on-one in many times, and I think all of you, if you haven't met her, I'm sure she's a busy person, but I'm sure she would be open to you reaching out to her, and she's got such great knowledge and experience on this topic and many more. And what we will do is I will reach out to Joan to get a copy of her presentation that she had mentioned, and for anyone who's interested in having it, we'll figure out a way to best get it to you all, or you could email Elizabeth at the church, and we'll make sure that you get a copy of it. So I just wanted to thank everyone for your time today. We're going to continue this journey of having these forums once a month on all these various topics. And I think hopefully out of this whole presentation today, hopefully if you get anything out of it, hopefully you'll see that you're not alone. We're all going through many different things in different ways, and we have such a great community in St. Mary's to come together to help each other and pray for each other and make sure that everyone remains good and okay and gets through all these difficult situations. But thank you, Joan, for your time, and thank you everyone for joining.
This is wonderful.
Enjoy the rest of our Sabbath.
Thank you.
Thank you, Jay, too. Thank you, Jay, for
you.
your continuing co-hosting of these too.
Oh, you're welcome.
I coerced him.
Wise choice, Joan.
Good, Kate. Okay, but you're next on the list.
Happy to. Thank you, Joan. Excellent presentation.
Okay. Bye, everyone.